Hey, my name is Brittany Arender, and today I'm going to be doing my Enteral 2 feeding checkoff. So the first thing I'm going to do is verify my physician's order, identify my patient, and check for any allergies. I've already verified my order. I've looked in the chart and I didn't see that the patient had any allergies, but I'm still going to ask him. Mr. Smith, can you tell me your name and date of birth? Perfect. Are you aware or do you know of any allergies that you might have? Okay, so he doesn't have any allergies, so that's good. I'm going to perform hand hygiene and don clean gloves. I'm going to prepare my enteral feeding. I'm going to shake it really good. I have a bag I've already set up here. Normally I would have like an IV pole where I could connect this to, but I don't have that, so I'm going to pour this in. I'm going to connect my tubing, prime my tubing, and clamp it until I'm ready to connect it to the NG tube. I am going to position my patient in a high Fowler's position, which he's already in. Mr. Smith, the doctor ordered an enteral 2 feeding for you today. Since you have a little bit of malnutrition, this will help with that, okay? So I've explained the procedure to my patient. I'm going to verify the tube placement for the NG tube. And I'm going to do that by testing pH. Okay, so the pH is where it needs to be, and clamp that back. So once I've verified placement of my NG tube, I am going to then check residuals. So looks like this patient has 230 mLs, so I'm going to replace it and flush with 30 mLs of water afterwards. Now, if the patient had greater than 500, or if he had residual of 250 2 hours apart, like let's say I checked it, 1 hour apart, let's say I checked it twice 1 hour apart and it was 250 or greater, or 500 or greater, I would stop any feedings. So once I've done that and I've flushed with 30 mLs of water, I am going to then attach my feeding to the NG tube. So with bolus feedings, they go by gravity. So basically I would unclamp this and let gravity do its thing. I would also flush with 30 mLs of water when that's complete. Now, let's say this patient has continuous feedings via a pump. I would set the pump according to the physician's order, and I would flush with 30 mLs of water every 4 hours during continuous feedings or before or after intermittent feedings. I would also check residuals every 4 to 6 hours. I would also change my bag set every 24 hours. I would, let's just say the patient had a PEG tube. So the PEG tube, I would check the site for any signs of infection. Sometimes there's like a couple of stitches around the PEG tube, so I would make sure that those are still intact. I would also clean that area every day. So, but this patient doesn't have a PEG tube. So I would also document my feedings. I would document any residual. I would document how the patient responded to the feedings, like were they nauseous. I would document any intake and outputs. I would also document the appearance and that I cleaned the PEG tube if the patient had one. I think I got everything with internal feedings. Thank you.